The regulations could be much stronger.
Sick meaning physically disabled or mentally challenged?
Either one.
Well, you can't physically see a mental
Sometimes
condition.
you can.
Not on antidepressants.
JoAnna, Cap, what do you think? Sounds like it would work for LA. We got 800.
You just cap it at 1,000?
If I was the only one, then, you know, I
Right.
wouldn't have much complaints.
Probably a good idea. How you get to that cap and who you allow is the biggest part. That's why I like the idea of operations type of license rather than just a land use. Because if you have a good operating one, you sell it, how does it guarantee that those new owners are going to be doing the same thing? Probably a cap in areas, for sure. I don't know about a whole city cap, but, you know, a cap in East Side, a cap in whatever the areas that are specified, you know, that dispensaries can be in. Just for the record, our average age of our patients is 40. Our oldest patient's 103. So if you do it right, you're getting those patients that really need it. We don't see a lot of young people. Although I'm humbled at times, I'll have a guy come in, talk with him. You know, he's got his pants down to here, you know, and tattoos and piercing, and I'm like, am I doing this right? You know, and then he'll take off his hat, and he has this huge scar where he was stabbed, or he rolls up his leg and he's amputated, you know, from a motorcycle accident. So what I found is I can't really make that judgment. I can do everything possible to make sure that they're in accordance with state law and local ordinances, but I've found myself to be humbled at times.
Yes, ma'am.
Oh, hi. My name is Mary Ann Cassidy, and I've been using medical marijuana for pain and nausea for around 4 years now. And I think there are inappropriate and irrational correlations being drawn between use of medical marijuana and recreational use of marijuana that are totally inappropriate. This is medicine. People who use it because it works better for us. I don't think we correlate the number of people who use amphetamines for, ADHD, whatever, with the amount of methamphetamine abuse in the community. I don't think we correlate the number of morphine or codeine or other, narcotic pain analgesics with the amount of recreational heroin use in the community. I think
Do you have a question?
parents who give their medical marijuana to their children are probably parents who give their narcotic analgesics to their children. And, it's just a comment. It's separate things. And I think if we're talking about dispensaries next to schools, we should be talking about pharmacies next to schools. And because it's, it's medicine.
Thanks very much for your comment. Next question, Kathy.
Hi, my name is Kathy Murillo, and I have 22 years clean and sober from alcohol and drugs, and I believe in medical marijuana because I think there's a difference between addiction and use for sick people. And this fellow here who has Crohn's disease looks perfectly healthy. You can't judge from what someone looks like if they need medical marijuana. But I think there's a hypocrisy about alcohol and painkillers. People abuse alcohol and legal painkillers, and those are legal drugs. And I think that the drug companies are behind it and the alcohol industry. I know that Coors Beer has given money to anti-marijuana legislation. They don't want people to grow the pure, beautiful plant that God gave us. I have a lot of respect for marijuana. Why? Because it kicked my butt. And I don't use it anymore, but I think it's good for people who need it. And I guess I'm not sure if I have a question, Jerry, except I just want people to recognize that there are these big pharmaceutical companies out there that why should we give them money for our health? No, we should be able to grow pot and take care of our own needs naturally.
Penny, what do you say? People use prescription drugs, use alcohol, all of these things. Is there a difference or a difference without a distinction?
Well, alcohol, is legal, and people drink and people get sick. In Santa Barbara, 1 out of 5 people have a problem with alcohol. are, so it affects people. I hate to have 1 out of 5 people have a problem with marijuana too. That means, so we have 2 out of 5 people using. I don't really know the answer. I'm just sort of jumping around, but I agree that the drug companies are doing something that I don't believe in either, but I don't know a better way to try to control marijuana than to get it approved.
We have, did you want to say? No. We have just a couple minutes left, and I'd just kind of like to go around and, for a minute or something, minute and a half, just give us your, kind of final message. What would you like to leave with the viewers in terms of this whole discussion, which has been fascinating. It's been great, and thank you all for really, I think, getting to some of the subtleties and nuances of it. JoAnna?
I think the biggest thing, and I keep saying it, is education. It's education, people really knowing the facts, not based on 70 years of propaganda. And I think that we have to look at really whatever medicine it is. And we also have to look at the whole person. You can't separate this from this. So we're looking at the whole, mind, body, and spirit for wellness for people. And there are many alternatives. Dr. Andrew Wiles says, whatever it takes. I think that people should have the freedom to put what they choose into their bodies. And if it's not affecting other people, but they do need the education of doing it correctly. Marijuana is no different. There's many strains, there's different routes of administration. People need to be educated in what they're putting in their body and using it correctly, whatever it might be.
Penny, what's your bottom line on this whole discussion?
I think my bottom line on the discussion is there need to be some good rules that are the same citywide, countywide, statewide, and there should be limited amount of dispensaries if there are going to be dispensaries. And I think that there should be regulations on marijuana.
Mark?
I have to agree with her as far as education. That's actually what creates all of the problem is the ignorance involved in the movement. As far as children, I think it's more of a parental issue than anything. I think if the parents were actually educated, then they could educate the kids on what it is that they're doing and separate marijuana from hard drugs. If marijuana is a gateway drug, it's because it's associated with everything else. You smoke some pot, you meet good people. Why shouldn't we go out and do something worse that's in the same category? Regulations are good. They just need to listen to the community. And I know that there's more than a handful of people in this room that would be willing to work with the ordinance committee, the city council, with Goleta, Santa Barbara, and the county to ensure that patients have safe access to medical cannabis at a reasonable price.
Marty, you're going off the council. You're free to speak your mind. What's your bottom line?
Good point, Jerry. No, local government is where it ends up, and no matter what the federal government does or the state government, we end up having to deal with whatever they pass. So we're caught between the two right now, and we need to listen to the residents of Santa Barbara. We need to figure out how many is correct for the city of Santa Barbara. We need to figure out good places for them, and so they aren't bothering neighbors. We don't want the crime that happened on the west side, which was just a terrible nightmare, actually, and it had to do with who was owning that dispensary. Luckily, it closed down, but, so we need to, at the local level, make sure that the quality of life for all our citizens is good, including the neighbors of these dispensaries and including the people who really need the medical marijuana. And it's a very difficult thing to figure out. But I hope that before I go out in the second week of January, we can figure out something. I would hate it to be a real long, prolonged decision. But we need to work with our residents, and I'm glad that there are people here who would like to help us. It's good.
Yeah, well, this has been a great discussion. I think it's really brought out a lot of different perspectives and shown how complex an issue this really is. And I think, just kind of from the political point of view, which is how I tend to look at things, because it's not been a settled issue between the federal government, between the state government. The local governments have been, left to kind of find their own way and scramble around. And, I think it goes to your point about sort of a lack of a standard, and nobody really knows what the rules are. So I want to thank all of you for coming, Marty Blum and Mark Russell, Penny Jenkins, JoAnna LaForce. Thank you very much for being here. And thank you all for watching. If you have ideas about Real Talk, or you have some comment, let us know about it. If you have a subject that you would like us to address, have a discussion like this, let us know. And we'll see you next month. Thanks very much.